Dr. Lochana Naidu, congratulations. I think that's in order. You've just been awarded the Freedom of the City of Sao Paulo. Please tell us a little bit about that unique honor.
Thank you so much. I'm currently Vice President of the International Narcotics Control Board, and one of the things that under my responsibility is to be able to do country missions and to be able to investigate different countries and their compliance with international treaties on drug control. And that includes treatment and border control, the provision of medication for illnesses and pain, and also controlling of stocks in countries and manufacture.
Doctor, back home, Julo Center has now become a landmark institution in the work of drug rehabilitation.
Yes.
Your approach is somewhat unique. Please, can you expound on that?
I think it's very simple. One of the areas that we believe we need to attend to is to be able to create a paradigm shift in our society. I believe that drug addicts, as people know them, are people who have a drug solution to life. So if we get drug addicts to stop the use of drugs, we're still left with a problem. And the problem is how to cope with life. So apart from detoxification of a patient, our next process is to be able to reconstruct their brain tissue. And we know that drugs damage brain tissue. We also know that people with brain damage of sorts can take drugs. So it's a very simple formula. If you have a broken brain and you add a drug to it, you'll get normal functioning. And that's the essence of Julo. So while we are repairing brain tissue in a very patient-friendly way, by using very simple, unique methods and encouraging repetition of this every day, we can, within the period of 28 days, really be able to get people to the position where they're feeling fundamentally much better. I'd like to introduce you now to some patient management software. This is very novel, it's cloud computing. What it actually says that patients should be treated as part of an interdisciplinary team, where the patient is involved, the social worker, the doctor, the psychologist, the psychiatrist, etc. Whoever, even the spiritual worker, the person working in the catering section, the person in admin, everyone should know about the treatment for this patient. So I'm going to introduce you now to the doctor's module. For example, I have a list here of all the patients that are under treatment. And I can give, for example, a patient, I can open up the profile for a patient. And as I open for the profile for the patient, I'll be able to understand and be able to allocate who's in charge of getting information about this patient. So we maintain confidentiality, etc. So this is actually a template of the management of the patient. And then we look at medication. For each patient that comes in, we are able to list the medication for this patient. Then we can set up a program, and this program is set up when he finishes the aftercare, which day, what session he uses. Then we look at notes, and in the notes is very interesting that the notes that I might put or my nurse might put is able to be transmitted to each other electronically. So every staff member involved in the treatment of the patient knows the information necessary. So we are not having any cross-communication, and the patient is unable to manipulate one against the other, and staff members are always kept in the loop.
Mrs. Pillay, you are the leader of one of the most progressive companies in Africa today.
Yes.
How did you get there?
When my husband passed away in 2005, I had a decision to make. And I chose to run with the company. And with my kids and staff, we've come to be where we are today.
But all your children were then very young. They were rather in the infancy. But you brought them in and you trained them. And training has always been part of your company.
Yes, absolutely.
Could you explain that please a bit in detail?
As a company, and especially for me, it is important to empower other individuals. And therefore, it was the aim for me, the children being so young, I had to give them something because this is the legacy that their dad built. And I wanted to keep that legacy alive because there's a lot of hard work had gone into this company from inception when my husband took over. He worked very hard. Initially this business was like a one-man band, one technician, one assistant, one vehicle. And now we're at a place where we are 100 strong staff members.
Yeah, as a tribute to your husband, he was the first black man to hold a very special qualification.
Yes.
Explain that please.
In the industry we have 3 levels. Level 1s are technicians, level 2s are senior technicians, supervisory level, and level 3s are the people that do the training, write out the manuals, also are equipped to go out in the field and make decisions based on what needs to be done, as opposed to the training technicians. And my husband, being an achiever that he was, went and wrote his exams in America and in 4 disciplines, and he passed, and came back to South Africa being the first black, non-white in the industry to have his level 3.
Madam, you were Entrepreneur of the Year. You were chosen to be Businesswoman of the Year. You were also chosen for various awards to pay accolades to you for your success in business. Has that put you in a leadership position?
I think yes, but most of all, I believe that if you have strong faith, as I believe in the Lord, nothing's impossible. And also, my belief is that if you believe in something, put your heart and soul into it, goals are not achieved sitting in a box. You've got to step out of the box to achieve your goals. I think one of my qualities are being tenacious, stubborn, and therefore I believe we've become a success. I never gave up when the chips were down. I never gave up. I just carried on tenaciously.
And the future?
Lots in the pipeline. We're looking at international. We've acquired work in the African continent, up in Africa. We're looking at getting branches overseas, but we do a lot of work overseas. We've done work in Qatar, Madagascar, Australia, and we're looking at expanding globally.
Madam, apart from business, you play a leading role in social welfare.
Yes.
You are into drug rehabilitation in a big way.
Yes.
Please tell us about some of your...
It's something close to home. It's something I never envisioned that I would go into something like this before, but I started working with families, and what I've noticed in the community in Chatsworth is that prescription drugs is rife, where especially women are taking it, and I think because of the economy being the way it is and people are struggling, they tend to try and numb their pain. I never knew that drugs like still pain, taken in a quantity, would actually be like a hit of heroin. I never knew that until I met people taking it, and I couldn't understand how this could be used as a drug per se. And when we did research, we realized that a few tablets taken at a time would give you an effect of being high in heroin. I've worked at homes where it really broke my heart to see that the children had to really try and fend for themselves. I rehabilitated a woman that was pregnant, and she wanted to abort the baby at the time I met her, but I encouraged her not to. Took her into rehab, we detoxed her, and baby today is 1.5 years. that spurs me on when I see these changes that take place in people's lives, especially children.
Okay, Doctor, when did you start Damien Hospital and why in Raystown?
I started Damien Hospital in the year 2004. I've been in private practice since 1991 in the Raystown area. And being in practice for so many years, I realized that this is a cosmopolitan area with a huge number of people requiring medical services and attention, not only during working hours, but also after hours. And with that in mind, I had a vision to open a hospital with an after-hours service and provide good health care for our people.
Doctor, we live in a very violent society. Do you have a trauma unit?
I would say I have a trauma unit, but not as specialized as the bigger hospital would be. But nevertheless, I can handle trauma cases here, admit them and treat them accordingly. And if necessary, refer to the bigger hospital if I cannot cope.
What can you stabilize their condition?
I can stabilize their condition. I also have ambulance attached to the hospital, which also belongs to me, and they can transfer the patient to hospital after stabilizing.
Yeah. Doctor, you have 7 ambulances.
7 years.
And all of it are in excess of R1 million each.
Well, fully equipped, I would say that, yes.
And some of them are an intensive care unit on wheels.
On wheels, yes, sort of.
Please tell us a bit about
Well, basically, I have an intermediate life support ambulances. We can treat quite a few patients and transfer them to ambulance, and also whilst transporting them, we can sustain life.
Well, what about a ventilator, heart-lung machine?
Well, we have a ventilator basically, but it depends when we need to use them. Usually we'll stabilize them here and then move them, but I wouldn't say that I use a ventilator in the ambulance that amount.
Yeah, Doctor, if you needed to send out a crew, say to a major or a mass accident scene,
Yes.
can your people go on the scene and handle it?
Yes, they can handle that definitely.
Okay, and do they have a special training course for them?
Yes, they're all registered paramedics who have undergone training for that.
Now, do you run the training courses or do they go to
You know,
institutions?
they go to other institutions, do the training course and come and work good for me.
Well, that's interesting, Doctor, because right now you live and work in Pietermaritzburg, and the hospital in Pietermaritzburg. You have a major highway going through the
Yes.
entry. There is a very high-profile traffic
Yes.
count, and there are also many accidents. Does this keep you very busy?
Well, I would say it keeps me busy. There's other competitors here, but it keeps me busy.
Doctor, what is the best way to be able to try and reduce this kind of accidents on our highways?
But as it is reduce the speed limit, people will drive more carefully and will be more vigilant with traffic offenders.
Another major problem with South Africans is being obese.
Yes.
Is this a major problem here?
Well, it is a major problem, but we must say now people are more conscious of their weight and their health, and they seem to be reducing their obesity.
Is there a training program in the city, or is there any health programs?
Well, these health programs, these slimming courses, there's a lot of things people are doing now to get people to be conscious of their weight.
Okay. Also, sugar diabetes is a major problem with us.
Yes, diabetes is a major problem, especially amongst Indians.
What can we do about it?
Well, I think we have to make the public more aware of it, let them know, either by air, by television, or by pamphlets, to let them know regarding sugar, what are the signs and symptoms of sugar and how we should treat it.
Is our diet or menus no good?
You see, I would say it just depends how we look at it. We must also remember that diabetes is genetically, it's a genetic illness that we have, all right? And people will get it no matter what. So we just have to be careful about our diet and be conscious of it.
With us today is Dr. Raj Singh, one of South Africa's most distinguished dermatologists, and you have a very exuberant practice. Doctor, tell us, what are some of the specialist treatments that you dispense with?
Thank you, Mr. Khan. I think you're flattering me. But we do some very unique treatments, which very few specialists or dermatologists usually do. Apart from the normal dermatology that we do, such as your normal, as we call it, the big three or the big four, whereby we treat acne, psoriasis, eczema, and skin cancers, we do a lot of cosmetic work. And with cosmetic work, we do everything from Botox. Botox is where we paralyze a person's muscles, so with the result they can look younger. And the other treatments we do is fillers, whereby we fill a person's face so that the person can look plumpy and remove lots of years of ages. We also specialize in a unique range of glycolic peels, whereby these peels, and we've got our own unique peels which are exclusive to Africa because they're imported from the United States. And then also we've got our own range of products, Dr. R.S. skincare range. Everybody thinks it's named after me, but it's actually named after my wife. Her name is Radhika Singh. And some of the ranges that we have are this is a very basic range whereby we have the facial cleanser, the deep cleanser, a unique soap. The soap is actually manufactured by me. We put the right content of glycerine, the right content of salicylic acid. We have a daily moisturizer and topical gel. These are very good for acne and eczema and psoriasis patients, and they quite very attractively priced compared to lots of the products on the market, because we don't aim to make a huge profit on these. We do like laser liposuctions, and as you can see, we do some unique treatments. For example, this lady was not happy with the knees, and as you can see with the knees, she wanted to wear short dresses and she wanted the knees to look much more impressive. So we removed the fat around the knees, rather unique. Again, this lady, she felt that she had very bulky thighs and she wanted to be looking much better with these thighs, with the calf muscles, and we did a calf muscles. This lady was not happy with the chin, and this is how she looked after having a chin nut. And then everybody wants to have the stomach. The stomach is also the most important area. This is how we do the stomach. This is how a person looks before. This is how a person looks after, before and after. And even those ladies with the saggy hands, especially in summer. This is a new E-Matrix. As you can see, it looks fine, but it's got 64 minor spots. And these 64 spots, pins, they actually penetrate your skin and create very small holes, which is like a fractionated treatment. And with these 64 pins, once they create small holes, they stimulate collagen and elastic fibers. This is a very unique equipment. It helps you, it replaces the old magnifying glass that we used to use. Like for example, if you have some problem, this can enhance your problem and give a dermatologist a very good description of the skin. As you can see, I'm using it on my own skin, and you can see the magnification is almost 100 times. So if you have any problems, you can always help in diagnosis. This is very good in skin cancers, etc., whereby we can determine whether something is cancerous or not.